People pay a lot for therapeutic ABA services. So as clinicians and ABA clinic owners and operators, we really have to ask ourselves, are we delivering? My perspective has changed over time on how I measure that, and in general on what qualifies as good science or good science as a service. I used to be more focused on things like preciseness of data collection, technical accuracy, and verbal behavior of my clinical team, teasing apart the conditions and contingencies in our analyses and treatment plans, and a great deal of reinforcement was derived from looking at or consuming graphic data analyses, so looking at trends in the data. And while these things are important, I evaluate whether I've delivered on different metrics now. Now I feel I've delivered when I could show positive outcomes for the following across my practice. So the first is patient and client satisfaction and experience. The second, clinical outcome measures. Third is procedural fidelity. So are we implementing what we planned to implement and what we're telling other people we're implementing. The fourth is inter-observer agreement. So are we accurately collecting data and reporting out on the outcomes? And the fifth is maybe slightly less discussed in practice, but it's demonstrating some degree of functional relation. So essentially, are the changes a result of the treatment we're implementing and not something else? This could be something as simple as reversal probes or something comparable, kind of done here and there. And I'll plan to discuss practical applications of that in a bit more detail in another video. Together, these 5 things tell a story, and that story goes a little something like this. We've shown that while working with us, therapeutic progress has been made. My client, and specifically my patient, agree that changes have been made and they were meaningful to them. And super importantly, that they enjoyed the process of working with us. We've demonstrated that we implemented what we said we would. We've accurately tracked and reported progress, and that changes made were a direct result of working with us and not something else. Put differently, we've shown our clients a solid return on investment and a positive customer experience for engaging with our team for their services.